Hello everyone, I am Neeraj Kumar Kaithal and you are watching For Nurses Preparation YouTube channel. In our today's video, we are showing few important points for the exams like norcet AIIMS, ESIC, CHO and other nursing competitive exams. So let's begin our today's video. Our point number 1 is NTG means nitroglycerin. Nitroglycerin is sublingually administered to treat the condition like angina pectoris. Sublingual route means the nitroglycerin medicine is placed just below the tongue in the mouth. So, to treat this angina pectoris, it is a sudden severe chest pain due to lack of blood supply to the myocardial muscles. After administering this nitroglycerin tablet, headache is a most common complication that can person have. If the pain not subsides after injecting the medication nitroglycerin, it indicates the person is having myocardial infarction or heart attack. Point number 2. Myasthenia gravis is an autoimmune disorder. In this, acetylcholine receptors destroyed. Myasthenia gravis, it is in short it is known as MG. It is an autoimmune disorder in which acetylcholine receptors are destroyed. Point number 3, endocrine gland secretes into the blood or lymph. Endocrine gland secretes hormone or their secretions directly into the blood or lymph. We can say they are the ductless glands. Next point from the OBG subject, contraction stress test measures the fetal response to uterine contractions. During pregnancy, we perform contraction stress test. Contraction stress test. In this test, we measure the fetal response to uterine contraction. We measure here fetal response to uterine contractions. Next point is point number 5. Microcephaly is usually the result of congenital cytomegalovirus or congenital rubella virus infection. First, let me describe what is microcephaly. Microcephaly is an abnormal condition in which newborn baby's head size very short. If a newborn baby's head size is below normal, this condition known as microcephaly. Microcephaly's important cause is congenital cytomegalovirus infection or congenital rubella virus infection. If someone asked a baby is born with a small head, what may be the cause? You can say it is due to definitely by infection. Which type of infection? Due to virus infection, and the virus name is cytomegalovirus and rubella virus. Next point, if chest circumference is measured above or below the nipple, a false measurement is obtained. If you want to measure chest circumference in a person or a baby, you should always measure on the nipples level, because if you take measurement above the nipples level or above the below the nipple level, it will give false reading. So always remember, whenever you are going to measure the chest circumference, you should place the measuring equipment at the equal level of nipples or at the level of nipple. Point number 7, hepatitis A. Hepatitis A is a liver disease. Hepatitis caused by hepatitis A virus transmitted through contaminated food and water. Hepatitis A is a liver disease. It is caused by the hepatitis A virus HAV, and the most common route of transmission of this disease is contaminated food or water, or we can simply say by enteral route, or we can say by fecal-oral route. Next is Colles fracture. What is that? Fracture of distal radial bone. Let me clear a thing first. The body part that is near to the trunk known as proximal part, and the part that is distal from the central or chest region known as the proximal or distal part, sorry. This is the radial bone found in this part of our body. This is the proximal end of the radial bone, and this is the distal end of the radial bone. If fracture occurs in the distal part of the radial bone, this fracture is known as Colles fracture. So always remember fracture of distal radial bone known as Colles fracture. Point number 9, normal room temperature. Important. Normal room temperature is 24 degrees centigrade. Always remember 24 degrees centigrade is a normal room temperature. Next, point number 10, gynecomastia. Gynecomastia is a condition in which hypertrophy of male breast occur. If the breast size of a male, if a breast size of a male get increased, this is known as the gynecomastia. There is a word hypertrophy. What it means? Hypertrophy is a condition in which cell size get increased. If the cell size get increased, this condition is known as hypertrophy. So the cells found in the breast get increased in their size, and due to this breast size increased, and this condition known as the gynecomastia. Another term used sometime, hyperplasia. What is that? Hyperplasia is a condition in which number of cells get increased. If in a person number of cells get increased, this condition is known as hyperplasia. You can take a screenshot for your revision. Next point is scoliosis. What is that? Scoliosis is a lateral curvature of the spine. You can see in the diagram a healthy person with laterally curved spinal cord. If a person's spinal cord laterally left or right side curved, this condition known as scoliosis. There are two similar conditions. One is scoliosis, that is lateral curvature of spine. If the spine curved anteriorly, this condition known as lordosis. It may be seen into the pregnant women and person with obesity. If the spines get curved posteriorly, what this condition known as? This condition is known as kyphosis. Kyphosis is a posterior curvature of spine, lordosis is a anterior curvature of spine, and scoliosis is a lateral curvature of the spine. Commonly, scoliosis identified in puberty stage and throughout adolescence. Scoliosis condition mostly identified at the puberty stage. Next point. Fetichism is use of an object to become sexually aroused. To become sexually aroused, if a person is using a particular object, this condition known as fetichism. Fetichism. Next point from pharmacology. Albuterol is a rapid acting bronchodilator for the treatment of asthma. If a person is suffering with asthma disease, he can be prescribed bronchodilator or rapid bronchodilator known as albuterol. Let's have a quick intro about asthma. Asthma is a condition in which person is not able to breathe properly. Due to asthma, person's airway become narrow, it whether it because of the excess secretion of mucus or some other region. And if the bronchodilator drug administered at the time of asthmatic attack, these drugs works on the airway and airway become opened or dilated, so a person can easily breathe. So always remember, bronchodilator are prescribed for the treatment of asthma, and albuterol is an example of rapid acting bronchodilator drug. Now let's talk about the two important full forms that are previously asked in the exam. First is IPPB. IPPB, intermittent positive pressure breathing. Intermittent positive pressure breathing. Next is CABG, coronary artery bypass graft. Coronary artery bypass graft. You can take screenshot for your revision. Next point is intramuscular injection for child, dose below 1 ml. If you are going to administer intramuscular injection in a child, you should take the solution or drug below 1 ml or 1 ml, not more than that. In adults, we can take up to 3 ml medication for intramuscular injection. Next point, the nurse have responsibility to assess, monitor and communicate the status of a client under her care. Nurse is responsible for his patient for assessment, monitoring and communicating with him or her about his health. Next and very important point, this point is asked by many times modifyingly. Simply remember the concept. Always use your leg muscles, not back muscles, to lift. If you are going to lift any substance, object or client, anything, you always have to maintain body mechanics, gesture, posture. So always remember, use your leg muscles, not back muscles. This is a star point of this video. Next important point is, always ask the client if he is allergic to any medication, plant or herbal supplements, even if he is in distress. When we are taking history from a client, we must ask him he is having any kind of allergy or not, even if he is in distress condition also. Next point is, frostbite is due to cold. If a person is exposed to extreme cold environment for a long time, he can have frostbite. And frostbite's treatment is amputation. Amputation means we have to cut that body part that is affected with frostbite. Next is classification of diuretics. Diuretics are the drug or medications that increase the urine output. Classification includes loop diuretics, osmotic diuretics, potassium retaining diuretics and thiazide diuretics. Classification of diuretic drugs includes loop diuretics, osmotic diuretics, potassium retaining diuretics, thiazide diuretics. You can take a screenshot for your revision. Thank you so much friends for watching this complete video. If you think this video is helpful, then please click upon the like button. Share this video with your friends in their social media platforms like Telegram, WhatsApp, Facebook, etc. Keep supporting, keep participating, because on this For Nurses Preparation YouTube channel, we are regularly uploading videos that are really very helpful in your upcoming nursing competitive exams 2021, especially for AIIMS, norcet, ESIC and railway, DSSSB, CHO and many more. Once again, thank you so much. Best of luck.